Welcome back to Dr. Isaac's Dentistry. Glad to have you join us today. Today we thought we would go a little out of the norm of what we've been talking about and kind of talk about what's on a lot of people's mind right now, kind of the elephant in the room. So today we'd like to talk to you about COVID-19, or as a lot of you may know, coronavirus. The reason we bring that up is there's not been many cases here in Kentucky yet. I think we're at about 6 or 7. But we are working closely and paying attention to the local health departments and things like that. And as this develops, we wanted to just kind of touch base and let you know things we're doing here in the office to enhance our already sterile techniques and the safety in our office. Doc, why don't we start off with the basics. Coronavirus, the word virus. What exactly is a virus as opposed to other infections and how we would get those?
Well, we speak of viruses as if they're live, like it's live tissue. Technically, viruses are not live tissue, but they mimic life. So if you they're described as being on the verge of life. That there's in order for it to meet the definition of life, it has to have a cell. But there are no cells with viruses. What it is genetic material. It can either be DNA or a strand of RNA, which is not as complex as the DNA. So I think most of them are RNA, and it's strands of RNA that are encapsulated with proteins, which are large molecules that are from amino acids that bond together and form like a shell for the virus to live. They're not allowed, but to occupy space.
Right.
And then on the outside of the proteins are lipids, which are fat cells, and that's how this coronavirus gets its name, from the fat cells that are attached on the outside of the proteins, and it looks like a crown, and thus corona. So that's how it got its name. So and viruses. I'm going to go ahead and use it that they just for semantics. Let's just say that they live. When they're doing their nastiness, when they're invading things, they'll find its way. They're so small. They're about 1/100th the size of bacteria. And you know how tiny the bacteria are. So we can see it. You cannot see it on an ordinary microscope. You have to use an electron microscope to see a virus. So it's 1/100th of a common bacteria. So once it gets into the body, then it can wreak havoc, and it attacks the individual cells and makes them. It'll actually make them dissolve, make the cells kind of split open, and that's how the virus will replicate. It'll use the cell's DNA and just kind of mimic that and start like a chain reaction. And I think you and I were talking earlier. Each person can then infect, I think you said 2 or 3 on this particular virus. Yeah,
and I was going to get into that. First of all, I want to make sure everybody understands. What we're going to cover here is what we're learning directly from the Centers of Disease Control, the CDC. And we're not here to increase anyone's fear. We want to actually relinquish some of that fear by getting some facts out there, and facts about how it relates to come to the dentist, really, and why you don't have to avoid care. Now, I will say, according to the CDC, they say that this virus spreads easily and it's sustainable. And basically what that means is it's not airborne, but it is transmissible through cough, sneezing, and touching surfaces. So if it was airborne, Doc, what does that mean if it's transmissible airborne?
Okay, let's go back to how virulent the virus is. How easy is it to get it? Well, it is actually a 2. It's on a virulent scale. It's a 2. If you remember, SARS a few years back was a 4.
Right.
Measles is an 18. Right. So it's you can't get it as easy as you could. The SARS, it's a little more, it's a little easier to get than a common cold, I believe, which is another type of virus. But what makes this virus distinguishable is that it's been killing people. Whereas a common cold generally doesn't. The flu does, and it's been very well documented. This one can be a killer if you're immunosuppressed, if you've got lung problems, if you have underlying heart problems, then it can be deadly. But as you and I were talking today, children for some reason are not clinically manifested by this disease. We don't see it in children.
Right, and if children are testing positive, they're not symptomatic at all. No fever, no cough, no nothing. They're just carrying the virus without becoming symptomatic.
They have the virus, but no symptoms.
Right,
Yeah.
and like you were talking about, immunocompromised. According to the CDC, the largest population in the U.S. that is the most vulnerable to the most excessive response to this are people 80 years and older, and people who are on that have had a transplant, that are on some sort of immunosuppressants for rejections and things like that, or are, like you said, otherwise immunocompromised. They've already got something going on that's compromised their system.
Yeah, we were talking today. Your child had influenza B, and you said it's going to turn into maybe A, but it doesn't. What happens is, because you had B, you're more susceptible to A.
Right.
It's totally different disease. Just like you might get some type of lung infection, albeit emphysema or some other thing, that because your system is trying to fight the other one. And we do it all the time with bacteria.
Right.
We treat antibiotics and treat them all the time with bacteria, because if their immune system's down, we'll go ahead and zap it with amoxicillin and try to knock it out.
Right, so that 80 and older and immune-compromised, they're the most at risk. CDC also tells us 60 to 80, you're second most likely. One of the other things, we were talking about infection. So, the flu, common cold, those things like that. So we do know that coronavirus, each person who is infected, is actively infected with coronavirus, can infect another 2 to 3 people around them. So one of the things, and the reason I bring this up, is the other part of that is it's also, they're considered contagious out to 10 feet around their personal space. The reason I bring that up is one of those things we've adjusted here in the office, which is personal contact. You always shook hands and did things like that, and that's one of the adjustments we've made here in the office, is limiting that personal contact.
And that's right, and that's kind of what we're talking about. That's what we want to talk today. We're not experts on viruses. Right. We got the Google out, or I did, and we made sure that we get the terminology correct. But yes, we want to make sure that we're doing here at Isaac's Dentistry, we're doing all we can to suppress any type of. We don't want to be a vector in here. Of course, a vector is any animal or man or beast that's going to transpose the virus to another person, and that's what we're trying to break that chain. Okay, so a fomite would be touching, like my glasses, if it had on it, that'd be fine. Vectors are live people, so we just don't. We want to make sure we stop that. We don't have that chain right there. We don't nip it right there.
And going back, if we look like early 80s, when HIV/AIDS really started to become prominent and was blowing up, the medical field in general, not just dentistry, but a lot in dentistry, changed drastically with our approach to patients.
Yes. I graduated dental school in '88, so in '84, when I started dental school, gloves were not even mandatory. They were suggested. When I became a sophomore, that's when the AIDS came out, and they were mandatory. So everybody had to start wearing gloves and masks. It was essential. So AIDS is what got everybody really on the forefront of making sure that we're doing exactly what is mandated. Now, I want to interject this. Whenever I get talking about this, since 1983, because we're using universal standards, and I said earlier, we treat everybody like they've got something horrible. We treat everybody like they got AIDS. If we treat you like that, then we know we're not going to spread anything else, because that's a tougher disease too. So since '83, there has not been a hepatitis B outbreak from a dentist, and the dental community is very proud of that. So,
yeah.
So that used to be something that was a showstopper for dentists. If you got Hep B as a dentist, your career is essentially over.
Right, and that shows how effective those precautions we live by every day are. And basically, what we've done is we've just taken it to the next step. We're not greeting with handshakes anymore. We're disinfecting the lobby and our back areas twice as much as we normally do, just making sure everything's wiped down, just common sense things.
We had a meeting this morning at 8 o'clock, And before we really thought we were going to do this show today, and we thought, well, what are we doing? How are we being proactive and actually trying to do our part? And really, the last week I have tried not to shake hands with people because it's part of our culture. You know, that's when you meet somebody, that's the first, they stick your hand out and you want to do it. But I've got to start pulling back more and just realizing, hey, we can't do that right now. We got to do the fist bump. We got to do the back slap or something.
Right.
And we got to be like right now. We talked about touching our face, our nose. I've got the biggest itch that we do it all the time. You know,
oh, yeah.
It's something we don't even think about,
Right.
but we do it. And I forgot the stats. I was talking today. I wanted to see if you guys could actually see how many times I touched my face during this interview. But it's pretty common. You know, we constantly do it. So if I've got a virus, if I touch something or got it from you, and I'm touching my nose and my eyes, then we can go ahead and give it to her, inoculate ourselves. So it's what we got to watch out for.
And, you know, we're covering this just because we are aware of it. It is kind of an ongoing issue in the news, and, you know, we're not sure exactly how big or small it's going to get. You know, we do want to say that, you know, there's nothing that's been reported here in Washington, Marion, and Nelson County as of this morning when I checked. But it's important for us all to be proactive. So that was, like Doc said, we had a meeting this morning, and one of the first things that we discussed was, how can we be a little more proactive than we've been to isolate ourselves and keep our patients safe when they come to the office? Because it's important to stay on your routine and do what you need to do. I mean, we can't just stop living life. But it's our obligation to make sure that you're comfortable when you come into this office and that you know that everything's being taken care of.
You know, we have hand sanitizers. I think there's one right behind you, Gary. But I've been just leaving it out in the open. We have them out in the waiting room. We have it right there as you check in, and we encourage you to use it. We always wipe down the office between each patient, but now we're just making sure we haven't missed anything. You know, we want to make sure that we're doing exactly what we need to be. So. And
we always wipe down the lobby, but now we're doing it a couple of, several times throughout the day, and the same with all the back areas that aren't patient rooms. So. So we just thought it'd be a good thing. Everybody's talking about this. We thought it'd be a good time to just kind of get out there while there's so few cases here in Kentucky, like I said. This morning when I checked the state website, there were only 6 cases. I know Fayette and so Lexington and Louisville had some. 729 in the U.S. as of this morning. But we just wanted to reassure you that as you're getting ready to come see us here in the office, or go to your doctor, or go about your normal daily business, that those of us that have that responsibility of taking care of you are taking that seriously, and we're trying to stay ahead of it by doing everything we're supposed to do and looking forward and trying to anticipate. I saw you picked up one of our most important things.
Right, before you say goodbye, of course, the face mask. Now, what exactly do these things do? We were talking earlier. This is not an airborne disease. You can't get it from breathing, but you can get it from aerosol, and you get it from spittle. You get it from saliva. You get it. And as a dentist, we've got spray and water. We got that hand piece going, so we've got a lot going on. So we're protecting you. We're protecting us. And when I have this mask on, I can't touch. I can reach all I want to now, because I can't. I can't touch something and actually infect myself or you or something else while I've got this thing on there. And that's what's good about wearing the mask. And it's almost second nature for us to wear a mask anymore. Sometimes when I come down and do lab work, I'll grab a mask because I don't feel comfortable unless I'm got something going and I've got a gloves and mask on. So that's how aware we are of. It's almost automatic for us to put it on there.
Right, and you said something I think is important to emphasize. It's not airborne, which means if you're next to someone, like I'm sitting next to Doc, I'm not going to catch this by getting breathed on. It's when you cough, those tiny little air droplets that come out when you cough, or when you sneeze, things like that, the little saliva droplets that will go when you cough or sneeze, that is what carries this virus.
Something else we Googled today, that the viruses will stay are alive longer on a smooth surface than fabric. So whenever we cough now, we're trying to cough into our sleeve instead of our hand. Smooth. This is not. So you can't infect anybody through the through the fabric as well as you can on a smooth surface.
Right, that's what they're saying through the CDC. Smooth surfaces, doorknobs, hard surfaces like desks, tables, things like that. Corona could be around for 10 to 24 hours. So somebody could have sneezed on that doorknob and you come in the next morning, touch it, you could have been exposed. But by wiping everything down at the end of the day and doing things that we're supposed to do, it mitigates that risk. So hopefully we're able to answer some of those questions, put you at a little ease. If you were putting off coming in here to our office or going to a doctor's office, you know, you should take a deep breath and realize we're all doing what we need to do to stay ahead of this and stay informed on this. So hopefully this was some good information when it comes to your decisions on whether to continue with your care you've got scheduled or not. Thanks, Doc, and we will see you next time right here at Isaac's Dentistry. Thank you.